Hello, thanks for stopping by. I'd like to share with you at this time a little bit of information about Medicare supplements. In particular, a Medicare supplement plan helps pay out-of-pocket costs not paid by Medicare. Here we go. Number one, these are the four things I'm going to cover. Number one, I'm going to help you understand the relationship between AARP and United Healthcare. Number two, I want to let you understand a little about the choices one has when one takes Medicare. There's kind of two fundamentals: Advantage plans versus Medicare supplements. Upgrade your Medicare coverage. Explore AARP Medicare supplement plans. There's several different supplement plans. That's mostly what I'm going to talk about in this instance today. And then I'm going to talk to you a bit specifically how you can kind of fine tune, tailor, get these things to match your budget. So here we go. Number one, to understand the relationship between AARP and United Healthcare. So here's the thing. AARP Medicare supplement plans. AARP is an organization advocacy for people 50 and over. United Healthcare is a health insurance provider, has over 50 years experience rather in Medicare supplements. Together they co-partner. So really the AARP makes it available to its members, and United Healthcare is the administrator with tons of experience and a lot of people that use them as their supplement provider. Okay, let's learn a little bit about Medicare and some choices one makes. So number one, you have to get Medicare from the federal government. Part A covers hospitalization. Part B covers outpatient, not hospital. That is doctor's visits, testing, even outpatient surgery, things that don't occur. This comes from the federal government. It's a red, white, and blue card. And if you want, you can pay the Part B premium out of your Social Security for taking Social Security. That's healthcare government from the federal government. Now, once you've got that, you have two options. Option one, which is the thing that's been done almost since the beginning in the mid-60s of Medicare, you can get a Medicare supplement insurance policy. And then you want to add likely a Part D, because supplements don't cover insurance, rather drugs, but they don't cover medication. You want a drug plan as well. So that's the thing. That's a traditional way. Then around 2000, the Advantage plans were introduced. They combine Part A and B. They have D, drug plan coverage as well, potentially. So there's two different options. These tend to cost less monthly, but they also have less coverage. These tend to cost more monthly, can have very thorough coverage. So let's keep going, look a little bit more. I'm going to spend more of my time in this instance talking about Medicare supplement. A little bit more about Part A. It is inpatient hospital care. Well, actually, if you leave the hospital and you go to skilled nursing, that's also part of Part A. If you go into a mental institution, that's a part of Part A. And then actually home health care. If for X number of days, if somebody needs to go to your house to change a wound or a catheter or something, then that's all Part A. So it's like when you go to the hospital, a little bit of stuff out of there. By the way, there's actually some hospices covered as well under Part A. Part B is largely the other stuff that happens. That is, if you go to see the doctor, if you have a minor surgery not in a hospital, ambulance, laboratory testing, that kind of stuff. There's actually durable medical equipment, for example, like wheelchairs, crutches as well. There's potentially some therapy, speech therapy and occupational therapy, and some preventative care, shots. So those are the two main components. Again, you get Part A and B from the government. Just a little bit about this. So here's what Part A pays when you go to the hospital and or the nursing skill facility, and then here's what you have to pay. So when you go to the hospital, there's a deductible, $1,556 in 2022. And after 60 days, somehow you're still in there, you're going to $389 a day. And then beyond that, it goes beyond there. Let's see. If you go to skilled nursing, the first 20 days are covered. You don't have to pay anything, but beyond that, you're going to pay $194 a day. So the message is this hospital stay we've talked about, there's some significant out-of-pocket expense for someone when they have Medicare by themselves. So you want to look at Medicare supplement to take care of your component of Part A. In addition to a $200-something deductible, the government Medicare program is approximately an 80-20. That is, the beneficiary has to pay 20% of the cost. So all this stuff you're doing not in the hospital, after that deductible, you pay about 20% of it. So those are the two things, Part A and Part B, that come out of pocket for somebody who's participating in Medicare. So you can get a series of plans that to cover those things that are your out of pockets. They call it alphabet soup sometime, okay? But we're going to look a little bit more details about that. A couple other things. Medicare, anywhere that Medicare is taken, you can use your Medicare supplement. So that's convenient. There's no networks. That's one of the things that people are kind of discouraged from using Advantage plans because there's network implications. There's anywhere that takes Medicare, you can use Medicare and you can use the Medicare supplement. You can have low to no copays. And that's the thing. Anywhere, that is, it will work anywhere in the U.S. Anywhere that Medicare works, it will work. So again, you're not regionally limited. Okay. Are you eligible? If you can answer yes to these questions, you're eligible to apply. Will you be enrolled in Medicare Part A and B at the time of coverage begin? Yeah. Are you resident of the state? And are you 65 or older? Or are you on for disability or in-stage renal, for example? So in other words, you need to be on Medicare, have Part A and Part B, and in that state. If so, then you can apply for a Medicare supplement in that state. MACRA is something, it was a law that passed, and basically what it did is if someone's turning 65 after Jan 1 of 2020, the F plan and the C C plans are no longer available. Now, if you're here it is 2022, if you're just now turning, if you're leaving an employer and you want to get Medicare, as long as you're under that, you can still get the C and the F plan. Otherwise, you can't. But there's some equivalent or close, not close, but similar plans you can get instead. Part D is what covers drug coverage. When you turn 65, 3 months before that month and 3 months after, you can enroll in Medicare, and you can sign up for a Medicare drug plan at that time as well. Okay, so let's see. Just a couple of remarks about these plans from United Healthcare. It's the largest Medicare supplement. 1 out of 3 Medicare beneficiaries are enrolled in a Medicare supplement from AARP/United Healthcare. The annual rate changes have only been 3.2% from 2015 to 2020. That is, they don't increase at a very high rate, only 3.2%. It's the only Medicare supplement endorsed by AARP or United Healthcare. And then they do have all states and most U.S. territories. Here's some compelling statistics about the quality. 94% of insured members are satisfied with their Medicare supplement from AARP/United Healthcare. 98% of the claims are processed within 10 days or less. That's a nice claim rate. And then 94% of the active currently renewed. So those are just kind of compelling, showing people really do like these plans. A lot of people have them. A lot of people like them. They also will provide some gym membership discounts and other at no additional cost. And typically the rates are pretty competitive. They don't tend to be significantly higher priced than other carriers. There are millions of folks nationwide that use these plans. Almost 50 years of experience in United Healthcare working with Medicare supplement, and 9 out of 10 people would recommend it. So I endorse this carrier. Okay, this chart is a nice chart, and what it basically shows. Remember that if you're only become eligible at 2020 and after, then you can't get these. So this is before. So I'm going to concentrate on this. These checks, so what they're covered. Remember, there's a series of things out of pocket for each person. And so A will cover the co-insurance for the hospitalization. The Part B co-insurance, it'll cover 3 pints of blood in the hospice. G is the most thorough coverage here. So you can dial in. As you might imagine, this is the higher cost, this is the lower cost. These are the things they'll cover. I endorse this one overall. This thing is the most thorough coverage that's available. F has checks by everything, if you will. And G has everything except for the Part B deductible, $233 in 2022. So I'm a proponent of this, but we can dial it in. We can pick which one of this alphabet soup you want as your Medicare supplement plan to go to Medicare. I find most people do G and N. And what you see is that's the thing. These are the things that pay out of pocket for Medicare beneficiary, and G is designed to pay most of those. You'll have very little out of pocket cost during the year if you get a G plan. This is kind of comparing the two. So that's the thing. It has excess charges, which very rarely happen, but at least it will cover the G plan. The C doesn't. And then F, like I say, it covers everything that F does with the exception of Part B deductible, $233. So it's very thorough coverage available. I like this plan. It's available. If you want to save some money, you can actually you can get a premium lower than the G plan with A or B or even N, but notice there's more things you have to pay for. Both, and all these you have to pay for the Part B deductible, nexus charges. Skilled nursing insurance is actually covered there. And I think that's all I'll say about that. Here's a scenario. Meet Florence. She has osteoporosis, broke her leg, and she fell getting out of the shower. After being hospitalized for several days, she was released to skilled nursing for an additional 22 covered days. During this time, she had 3 follow-up appointments with her doctor. This is a comparison. So depending on if she had just Medicare Part A by herself, if she had a plan N, or if she had a plan G, this will show what would happen. The Part A deductible, either one of those, she wouldn't have to pay that. If she went Medicare only, it's going to cost her out of the pocket. The 2 days of skilled nursing, if you'll recall, it's $0 paid by Medicare, except for co-insurance. Yeah, so she has to pay $389 for 2 days. after that because she was there. The first 20 days are covered. Those last 2 days are not. So she had to pick that up. Plan G and Plan N cover that. So she wouldn't have to cover that. Part B deductible, both these, everybody has to pay that. And then here's the thing, co-insurance, the 20%, that is covered by Plan G. So you have to pay $60 if you had Plan N. And then it would cost her 20% of the co-insurance would be $93. So with just Medicare alone, that little incident for her cost her $22.70 out of pocket. If she had an N plan, it cost $290. If she had a G plan, it only cost $230. Okay, so that just kind of shows how those plans work. To reiterate, these are, because of MAC are unavailable anymore. These are available. G and N are available, and this is the most thorough coverage one. Okay, briefly about some discounts. There is a $2 off if you pay electronic EFT. If a second member's enrolled, there's 7% to be saved there. And then if you pay it up front, you can actually save $24. So there's some additional savings or out-of-pocket savings on a plan from United Healthcare. Renew Active is a wellness program. When you sign up for this, you remember that as well. And that makes some online resources available to you. And one of the things that people like to see is a gym membership at a location near you at no additional cost. Dental discounts, you get some dental discounts and get some vision discounts. This right here, as you can see on the dental, you can get 30 to 40% off rates for dental services like cleanings and fillings and crowns. So dental discounts there. On the vision, you can get an eye exam for $50, and you can get a $50 off frame if you're going to when you go to Lens Crafters. So some additional savings when you join. There's also a hearing discount. You can get $100 off of hearing devices. 24/7 nurse lines made available. That's actually a driving safety course, and then AARP Staying Sharp. It's kind of brain exercises online. So this is all the additional stuff you get above and beyond what the government defines as the G plan, for example, those the copay coverage. There's some additional services that United Healthcare / AARP make available. There's some disclaimers on that, and that's the thing. Those discounts stuff are not insurance. They're literally just discounts. And Renew Active, it is a membership, and you will get a $0 gym membership near you. Not every gym accepts it, but there are plenty near you. They have a large network. Okay, in addition, when you sign up for Medicare supplements from United Healthcare, you get a membership at AARP. So you'll get discounts on everyday items like grocery, carpet, and electronics from them, discounts on health and wellness like health supplies. You get a subscription to the magazine and the bullet from AARP. There are actually some travel discounts like on car rentals and hotels and flights and cruises. And then there's significant information, useful information in there about Medicare and Social Security and things that are interesting to people 50 and above. That's it. My name is Tom. Reach out to me. The best way to get me is by my email address, tom.basie@gmail.com. I'm glad you stopped by today. Let me know if I can be of any further service. Otherwise, have a good rest of your day.